Coronavirus cases are on the rise in the U.S., with a number of states breaking records day after day. 122,000 cases were reported on Thursday alone, breaking the record of 100,000 set the day before. The total number of confirmed cases in the country is now more than 9.7 million, with a death toll reaching past 235,000. 15 states broke their single-day record for new cases on Thursday, and hospitalizations are on the rise. Dr. Cioe-Peña joins me now. He is the director of Global Health and Northwell Health. Dr. Cioe-Peña, thank you so much for being with us. Of course, we're in the middle of this presidential election, which is, capturing everyone's attention. But in any other, time, we would be talking about this as our lead story, this incredible sort of surge in daily cases. As we mentioned, 122,000 cases were reported on Thursday now, and that's a number that jumped from 100,000 a day earlier. What does that tell you about where we are battling this disease?
Yeah, thank you for having me again, and it's good to be here. I think what it tells us is that we're again kind of facing these worrying trends in numbers, and we're starting to lose ground against COVID-19, and it's the numbers are very concerning. We certainly have increased our capacity since March and April, when this first came over our shores. But even that increase in capacity can be dwindled and dwarfed compared to the rate at which this virus can spread when left unchecked. And so, unfortunately, we don't. I'm worried about the numbers.
And so, what is happening to hospitals as this surge continues? Because it's something we were discussing a while ago as we started to see these daily rates inch up. When the numbers in hospitalizations, when that would follow, how much of a delay would there be? And now we are seeing the surges in hospitalizations. Are hospitals equipped and prepared to handle this surge?
So certainly we're more equipped than we were in early 2020. But everything has limits. And, the hardest thing, it's easy to put together additional beds and find additional supplies. But people are really the most tough resource. And, finding nurses, finding available doctors, especially in a time when the entire nation is gripped with this and not just an individual area where people from neighboring states or from across the country can come in and lend a hand. We're no longer in that situation. And we are seeing these case numbers rise, and the hospitalizations do lag 1 to 2 weeks behind. So, these record numbers of new cases, we're not going to see record numbers of hospitalizations for another 1 or 2 weeks after that. And so it's got everyone very concerned. We are certainly more prepared than we were in the spring, but without curbing the transmission, there's no amount of preparation that would be good enough.
And then isn't it also the case that the hospitalizations lag the infection numbers, but then the deaths follow a couple weeks after you get a surge in the hospitalizations?
Yeah, correct. So everything's kind of causally linked, and so first your case numbers go up, then your hospitalization rates go up, and then your death numbers lag 1 or 2 weeks behind that. We're getting better at treating this, and so we are seeing a reduction in mortality. That usually translates to more resources in the hospital needed, though. When people aren't dying from COVID, that's a great thing, but they also stay in their hospital beds, and so there's going to be a crunch unless we can get ahead of this and turn it around. We're looking at another bed crunch and human resource crunch all over the country.
All right, so let's talk about what the country needs to do to get this back on track. I mean, clearly, because of the way this virus has spread, there needs to be, a national response this time around. I think perhaps, and you can speak to this much better, much better than I can, but it seems that the way we initially responded to the coronavirus, which was very local in response, hasn't served us as a country very well. So at this point, now that we're sort of on a second wave for many places, some places, I guess it's their first wave, but how should we respond as a country in terms of a national response?
Yeah, I mean, we need to be uniform about this. It doesn't make sense to require masks in some towns and not require masks in other towns. I mean, there's a very simple formula to beating this virus. It's wear a mask, socially distance, and wash your hands. It's not complicated. The political nature and human nature has made it a complicated goal. But this is not something that we have any doubts on. This is how you break the spread and break the transmission cycle of this virus. And if we all do it, we'll see case numbers plummet.
And so if you were in charge of the national response, Dr. Eric Cioe-Peña, what would that be?
I mean, we need to emphasize across the board that people need to wear masks. Social distancing needs to be enforced. We have to get rid of temporarily any kind of large group indoor gatherings, especially all these risky kind of super spreader events. We've got to pause them. They need to stop. They need to go away. And I think we'll see case numbers plummet. And it really, if we did this seriously for 3 to 4 weeks straight as a country, it'd be a totally different ballgame coming out of it.
Oh, if only we could all get together and do it. All right. Well, Dr. Eric Cioe-Peña, thank you so much for joining us.
Thanks for having me.